so this is my subcutaneous injection, so my SQ injection. So you always want to check your MAR 3 times before you inject your patient. So the first 2 times is before you walk into the patient's room. You're checking that MAR, you're checking the expiration date of your injection. You always want to make sure that things match up before you give them to the patient. And then you want to go ahead and enter the room with your supplies. You are identifying yourself as a nurse and advising your patient, I am the nurse, I'm here to give you your injection today. While you're doing that, you're also going to identify 2 patient identifiers. So ask them verbally, what is your name and date of birth? Check their patient ID wristband. Make sure that they add up. While you're doing that, go ahead and ask them if they're allergic to anything. Do you have any allergies? What are they? If asking them these questions. Then you want to go ahead and you want to check your MAR for the 3rd time at the bedside, making sure again this is the right injection. And then you want to go ahead and just perform your hand hygiene. You're gloving up. While you're doing this, you want to go ahead and discuss what this injection is, what medication you're giving them, how you're doing it, so it's going in as an injection, where it's going in, what the adverse reactions could possibly be, and how to look out for them so that the patient knows if something is wrong, they can tell you immediately. And then you want to ask them, do you have any questions for me? Did I explain it well? Do you know what's going on? Just so that you give them a chance, that writes the medication, you're giving them a chance to reject this medication. So once you glove up, you want to go ahead and you are choosing your site. So for a subcutaneous injection, there are 3 sites you can give it. You can give it in the abdomen, you can give it on the outer thigh, you can also give it on the outer part of the arm. So we're going to do abdomen just because it's a little easier with my patient. So you also need to choose an injection site, or not an injection site, but a needle. And in order to do that, you need to make a fold of the patient's belly. And so you just kind of pinch, and then you want to make sure that you choose a needle that's at least half of what that size is. So you choose your needle, and then you want to palpate the area. So you're checking to make sure that the area isn't tender, there's no hard masses, so you're just lightly palpating. If there is tenderness, if there is hard masses, choose another site. You're now going to choose the legs or the thighs. You can also, of course, before you do this, you also want to check the MAR to make sure where the last injection was given. So the nurse before you maybe gave it in the arm, so you don't want to do the arm again, you always want to rotate. And you can also ask the patient, where was your last injection given? So once you choose your site, we're doing the abdomen. You're going to want to go ahead and remove these gloves and put clean gloves on, because you're putting an injection in somebody's body. You don't want to cross-contaminate anything. So you remove your gloves, put new gloves on. You're going to clean the patient. So you always want to start where the injection would go, and then you're doing a circular motion outwards, about 2 inches you're cleaning. And then you want to go ahead and take your needle, you would just pull the cap off, and then you would hold it like it's a dart. So between your thumb and your forefinger, you would go ahead and make a fold of the patient's skin. So if you were doing this with a injection pen, or if it was heparin, you would keep that fold while you inject the medicine. But for this normal injection, you would go ahead and inject in, let go of the fold. You would keep your hand on the patient just for stabilization, and you would push the medication in slowly. If the patient's obese, you want to go ahead and make that fold by pinching the muscle, but you would actually go in at a 45-degree angle, and you would go right below that fold. So 45-degree angle and over. So for this instance, it's a normal patient, they're not obese, and we're not giving heparin. We're just going to go ahead and stick, let go of that fold, you're going to inject the medicine in, you're going to take it out, safety, always safety your needle. Once you safety, you'll put the gauze on. Now you're not massaging it, you're putting gentle pressure on it. If this was heparin, you're going to want to go ahead and just put gentle pressure on it for about 30 to 60 seconds. But this patient wasn't getting heparin, so if the patient was still bleeding, you could always give them a Band-Aid. And then you want to stay with the patient for several minutes because you're checking for an allergic reaction to the injection that you just gave them. So you want to go ahead and put this in the sharps container, and anything else, like if you had a hub or anything like that, you put it in the sharps container. You'll go ahead and throw away all of your supplies, including your gloves. At this point, you could put the patient, before you let go of your gloves, you could put the patient in an upright position or however comfortable they want to be. Throw away your gloves, hand hygiene, and you want to document. So you are documenting the medication that you gave, the dose that you gave, as well as where you gave it, so the site of the injection. Again, you're trying to stay in the room for a couple minutes, talking with their patient, making sure that they're not having one of those allergic reactions. And then you want to advise your patient, remember the adverse reactions. If you do have any of them, immediately call me. If not, I'm going to be back in about 15 to 30 minutes. I'm going to go ahead and inspect your injection site. So when you do come back for that inspection of the site, you're checking for adverse reactions at the site, so inflammation, things like that. So that would be how to give a subcutaneous injection.